know, there's millions of us baby boomers that want to continue a lifestyle of working hard and playing hard, but for some folks, the body's given out before the desire does. So what are they doing about it? Dr. Scott Ball joins us this morning from the UCSD Medical Center to talk about a new kind of joint replacement surgery going on here, kind of updating an old surgery. Let's talk about hip replacement surgery today. The old way of doing this was what?
The old way of doing a hip replacement would be to remove the arthritic surface of the joint by actually removing the entire top part of the femur bone, the thigh bone, which is the femoral head, and then placing a stem down the femur, and then placing a ball and a socket to replace the socket.
Okay, so that's really removing a large part of the natural surface. Move your hand right there, and they'll be able to see that. There you go, perfect. So you actually have to remove a large amount of the joint. Well, you remove all the joint, basically, the ball and socket.
Exactly.
Completely, and then run that pin all the way down. And there's a really good graphic demonstration right there of how much that involves. Now, what was wrong with this? And a lot of folks, got a new lease on life thanks to this procedure.
Well, this is actually one of the best surgeries that's probably ever been developed in terms of getting somebody back to a really high quality of life and activity. The problem is when you put these devices in younger patients, sometimes they don't stand up to the test of time. It's similar to a car. If you're going to put a lot of miles on it and a lot of hard miles on it, like some of these younger patients that want to get back to tennis and...
Well, Mary Lou Retton has been in here, and she's had hip replacement surgery.
Right.
And, very, very young lady.
Exactly.
So that hip replacement is not going to last her until she's 75?
Possibly not. It's Bo Jackson. Everybody knows the story of Bo Jackson. He had a hip replacement at a very young age, and I think he may be now on his third hip replacement.
Oh, man.
Right. So the idea of the hip resurfacing, which is a newer type of procedure, is to try to save some of the bone of the proximal femur of the thigh bone. Instead of removing the femoral head and putting the stem down, instead you reshape the surface of the damaged surface of the joint and place a new ball on top of that, and then also place the new socket into the pelvis.
So there's fewer parts, and as we can see here, you leave a lot more of the organic structure.
Precisely.
Okay. They're not doing this, though, all over the world just yet. And actually, they were doing it in other countries first, and a lot of folks were leaving the United States to go have this procedure. Now, where is it available now?
It's in May of last year. It received FDA approval, and there's a number of surgeons that are starting to do this, but it's still relatively restricted in the United States. You have to have special training in order to do the procedure. There's a couple places here in town, including UC San Diego, where I work, and there's centers that are coming up in basically all the major cities. But
so this is the latest, newest thing right now.
Right.
Is everybody a candidate for this that would have been a candidate for the older hip replacement surgery?
Not exactly. The major benefit of the resurfacing is that you save the bone of the femur. The bone has to be good quality bone. If the bone is weak in any way from osteoporosis, for instance, the weakened bone may not support this prosthesis very well, in which case a total hip replacement, as I said before, is an excellent procedure.
It's still a great procedure, so we don't want to mislead people on that. But
right.
Now, so this one would last longer?
The longevity of how long each one of these may last hasn't been established as to which one may be superior to the other. The primary benefit is that you're saving the bone, so if the total hip replacement fails, you start off with this stem and the femur. If this fails, then frequently you
cut
have
off
to,
more bone, longer stem.
You have to go to a really large stem such as this, which is what you try to avoid. If you start by saving bone, starting with a smaller prosthesis, if that fails, you can go to just a primary total hip. So.
Okay, well, it's absolutely fascinating. We've got more information at fox6.com for anybody that wants to know about that. And like Mary Lou Retton said, even if you're a young person, if you're having a lot of hip pain, it's not going to get better. Your doctor's told you
Exactly.
that. Then don't hesitate to look into that as an option.
Exactly.
Great to talk to you.
All right, nice talking to you.
Thank you so much.